Imagine a headache so intense, the only thing you want to do is go into a dark room and shut out the rest of the world. Well, we're talking about Megrams. So does anyone know what that means? Spot on. It's another word for migraines. And I want everyone to give a warm welcome to actress Ginny Garth. And Ginny's had to manage a balance between a successful acting and directing career, plus being a mother to 3, all while dealing with this lifelong condition of migraines.
Yep. I've had headaches and migraines for years. I can remember when I was a little girl having headaches, and I would lay down on my mom's lap, and she would put a cold compress on my forehead.
So can I ask you what your symptoms are when you get one?
Sure. It's always different. Everybody has different symptoms for a megrim. I like that word.
It's kind of a cool word.
It's like a fun way to say migraine.
So when you have your symptoms of it, no, I do like the word.
You're so handsome. I was like lost in your eyes for a second. Great. Anyway, I'll talk to you then. No, not me. Okay. Anyway, I go into a dark room and I try to keep the light away from my head, my eyes. It's like a visual sort of sensorial thing for me. So smells are amplified, lights, vision. I have a girlfriend who goes blind when she gets a really bad migraine. So everybody's different, and it's so interesting as I'm doing this education campaign to sort of find out everybody else's symptoms, and everybody else's ways of dealing with it. Obviously, if you can stay away from prescription drugs, that's always best. So try an over-the-counter, something that can give you relief. And we have a great resource. It's called migraineresource.com. And you can go on that website, find out a lot of information, and it's very helpful, actually.
And it's important to know that migraines are what we call in medicine a diagnosis of exclusion. So if you immediately start developing headaches, you've never had headaches before, your doctor will go through some testing to make sure there's not something else going on. Once you get that diagnosis of migraine, that's when we get into treatment options. Like you said, there are prescription treatment options, but there are other things that you can do when you feel one coming on.
Right.
Some people have triggers, just like you were saying, sometimes it's smell. For some people, it can be certain foods like red wine or aged cheese and things like that.
If you don't drink enough water, that's a good trigger to people who are dehydrated.
Right, or if you don't eat enough, if you start to, get your low blood sugars going up and down. And for women who are much more prone to migraines, it can actually correlate with the cycle, and you can have menstrual migraines. And some women get better with pills, birth control pills, and some get worse. So it's really important for women just to actually time when it occurs, because it could be a hormonal trigger as well.
And does your daughter have headaches?
I have a little girl, my middle daughter, and there she is, my little choo-choo, the medium-sized one. She gets really bad headaches. I mean, she hasn't been diagnosed with migraines, but I was wondering, have you found that migraines or bad headaches are hereditary?
It absolutely runs in families. 4 out of 5 migraine sufferers actually have a family history, and they've shown if one parent has migraines, then that increases your risk as a child of 50%. If both parents do, then 75%. So there definitely is a genetic and factor to it.
That's interesting. When she comes home with a headache, I'm like, drink some water and lay down, and usually that'll help her out a lot.
They actually make caps that you can put on your head.
No, a cap?
Yeah, that's cold.
Oh,
to try and help you with migraines as well.
Would you mind? He should try this on, right?
I think so.
I don't have a headache, but I think it'll match my scrubs. So.
There.
Now, I'll tell you what, if I could go into a nice, cool room, dark room, this thing is nice. So would you take me seriously, Jenny, if I walked into your room? You're coming to the ER, I'm like, hi, I'm Dr. Stork.
Absolutely. No, I totally would. You actually look more official now, somehow.
And one other interesting thing, some studies have shown that acupuncture can be beneficial for people who suffer from severe headaches. So there are so many options out there. Takeaway, I think that you're here to discuss as well, is that you need to be able to control your migraine symptoms so that it doesn't take over your life, because it truly can be debilitating. And I think you're spreading such a wonderful message to be out there talking about it.
Yeah, I hope so.
Thank you.